Hi class, this is Miss Yvonne. I'm having a little problem with the video, but the audio is working, so we're going to roll with this short lecture. I want to talk to you about something that's very, very important, a medical assistant's role when it comes to administering medication. It's your responsibility and your duty to know the medications you're getting ready to administer to the patient. It could be in a matter of life or death. It says administering a medication is one of the medical assistant's most important duties and responsibilities. The medical assistant is expected to be knowledgeable about the medication and its side effect. Know your drugs, guys. And one more important step to knowing your drugs is knowing your patient's allergies, because sometimes that makes a difference with the drugs that they're taking or administered. It said medication comes in many forms. We've talked about the several forms that the medication come in oral, parenteral, or inhalants. Medications are always given under the supervision of a physician. The physician must be physically present within the facility at the time that the medical assistant dispenses the medication. Guys, if you get a verbal order from a physician to administer medication, make sure that that physician signs that verbal order. Don't ever get a verbal order and just administer medication without having your physician signing it. Even an RN, a physician's assistant. A physician's assistant can order medication, but in RN, you need a physician to sign a medication that you're getting ready to administer. When administering medication, the medical assistant must always observe the 3 befores and the 10 rights. What are the 3 befores? Let's go over the 3 befores. The 3 befores: medication must be checked 3 times before administration. Medication must be checked at least 3 times before administration. Before medication is removed from the medication cabinet, before medication is poured, drawn up in a syringe, or placed into a medication cup, and before the medication is returned to cabinet. Guys, you've got to check it. You've got to check it. Let's look at the 10 rights. 6 rights to make sure each time you administer a medication: the right patient, right medication, right dosage, right route, right time, and right documentation. So very important. These are all legal documents, guys. Always use your identifiers. Find out who that patient is sitting in front of you. 4 additional rights to consider when administering a medication: right patient education. Know something about the drug that you're administering. Right to refuse. That patient has a right to refuse that medication. The right assessment. Sometimes if you give a steroid, patient has to sit a while. Make sure there are no hives, no swelling, no redness in the area that you've given the injection. And always document if none of these things are going on. Patient has tolerated whatever you've given them well. Patient has tolerated this injection well. Patient has sat for 10 minutes after receiving this medication. Always document, guys. And the right evaluation. The right evaluation. Although errors rarely occur, if the error does occur, a notice must be given immediately to your supervisor or to whoever's handling the situation. It's detrimental to your patient. We talked in class earlier this year. If you hit a car and you stop, it's an accident. But if you hit a car and you keep going, it's a crime. Be honest. If you give the wrong dosage, let somebody know so that they can start getting that patient the help that they need. Okay, thank you for listening, and I'll get back at you maybe tomorrow evening. Thank you. Bye-bye.